Yes, bit about Neisseria meningitis and Neisseria gonorrhea treatment. So, Neisseria gonorrhea is a sexually transmitted infection in men and female. It's the same, and it gives pelvic inflammatory disease. So, initially in earlier era, it was sensitive to penicillin most of. Now it is resistant even for coamoxicillin. So now more often treatment is third generation cephalosporins, cephtraxone, cefotaxime. Or even we can give IV cefixime and cefepime, oral cefixime and IV cefepime. For the meningitis, we give ceftriaxone or cefotaxime. About the Morexella, it's a true ophthalmic pathogen. But not only ophthalmic means eye, it gives rise to respiratory tract infection, urinary tract infection, even severe form of infection as well. So it is a gram-negative bacteria. It's rod-shaped. It's a cocobacilli. In some cases, it exists as diplopocus. That's why it comes with this section. So major pathogen is Morexella cataharis. Earlier era, it's a low virulent pathogen. Nowadays, it's emerged as a pathogen and it is more commonly seen following hospital acquired infection. It is aerobic, non-motile, and it resides in mucous membranes. Invented by Victor Morex. Other than Morexella cataharis, there are few organisms, non-leucophasians, Lacunata, and Eurythralis. But our main concern is Morexella cataharis. It's a non-motile, gram-negative, aerobic, oxidase-positive diplopocus. Cause infection in respiratory system, middle ear system, central nervous system, and joint of humans. So it adheres to host via adhesions. So morphologically it resembles Neisseria. Here also in the blood agar media, you can see it grows in blood agar, not like Neisseria. So you can see non-hemolytic colonies. So with cultivation at 24 hours at 37 in aerobic atmosphere with 5% carbon dioxide, similar conditions but different media. So it causes inflammation of middle ear, cause to acute otitis media. Mode of transmission is contact-acquired droplets. Infection in adults. It, as I said earlier, it infects as a true pathogen, but it's frequent lethal infection also appear there as endocarditis, laryngitis, bronchitis, and pneumonia. And most often it is not in mainly immunocompromised. Those who reside in long-term hospital care facilities, they are more prone to develop this condition. In children, it causes meningitis, otitis media, pneumonia, bronchitis, even bacteria. Pneumonia. Infection in the lungs typically doesn't cause more often pneumonia. It's adults with weakened immune system or chronic lung diseases. COPD, cystic fibrosis, they are more prone to develop this infection. Bronchitis also same. Sinus infection also in the same manner. You can see greenish yellow discharge in the nose and fever, features of sinusitis. COPD pathogenesis, you know, gives chronic bronchitis, emphysema, and refractory asthma. It also causes conjunctivitis as well as meningitis. Meningitis in newborns also appearing. Prevention, mainly universal precautions, that is good hand washing, hand hygiene, sterilization of instruments and tubes. Aspirations or invasive procedures may be followed with adhere with the standard precautions. Usually prognosis is poor for hospitalized patients with underlying conditions. Patients hospitalized for prolonged periods are more prone to develop this. Treatment is sensitive to coamoxiclav and second and third generation cephalosporins, cotrimoxazole, and alternative macrolide like azithromycin also there. So that's about it. Thank you very much.